Go.
Hi everyone, my name is Sarah Kamphaus, and tonight I'll be reviewing an article that's all about addressing occupational therapy and its role with falls, specifically at current research in the area of fall prevention, and where we should really go from here. The article is Occupational Therapy and Fall Prevention, Current Evidence and Future Directions. It was written or conducted by Nancy Leland, Sharon Elliott, Lisa O'Malley, and Susan Murphy. The really important reason why we need to address this is that OT has a big role in fall prevention. 30% of adults aged 65 or older fall every year. 10% of these suffer severe injuries that can result in decreased independence, loss of home or failure to be able to return home, or a change in their living status. Maybe they can't be independent in the home now, they have to go to an assisted living. They might have reduced activity participation or even behavioral changes where they're now afraid to leave or afraid to go places because they're afraid to fall. And this is a great area for OT and OT intervention, and we're really able to provide this intervention through strength training, balance training, environmental modifications, and even some other areas when we address things like medication management, those behavioral aspects of reducing that fear of falling, and then even things like recommending appropriate footwear. Don't wear those slippers with no backs. So it really is an important area for OT, and it's a highly needed area for us to address to help reduce these problems that our older population have with falls. This study asked the question, what is known from the existing literature about the role of occupational therapy and evidence-based fall prevention interventions for community dwelling, older adults 65 and older? And how they did this, they did a literature review and they looked at any OT current research that dealt with falls or fall prevention. They did this through what's called a scoping review. And so all they did was summarize current evidence out there, and then use that to identify where there are gaps or inequalities in this evidence versus really examining the quality of the evidence itself. So they looked at articles from 1990 to 2010. The articles had to be written in English. They had to look at the community dwelling population in 65 or older. They had to include interventions that had OT, obviously. They had to evaluate falls or fall-related outcomes. And they had to be from peer-reviewed journals only. No OT practice, none of those kinds of things. So, and then it had to be quantitative research study examining a fall-related intervention. So the results that they found, they didn't go into a whole lot of detail on their results. They really kind of summarized how many articles they were able to find. So they looked at environmental modifications, so changes to the home and adaptations. And the recommendations were really inconsistent on falls and the effectiveness of these interventions on reducing falls. The studies were varied in their results. They also looked at exercise interventions. And again, the results of these studies on the benefits of exercise with reducing falls varied and were inconsistent. And none really compared doing road exercises to occupation-based exercises on maybe which one is better or more effective at reducing falls. They also looked at multifactorial, multi-component interventions. And they found that OTs, when they're working in this area, are really addressing environmental modifications and home adaptations, or they're doing functional assessments. They did find one where OTs were using a group approach to treatment for fear of falling and with patients on reducing falls. And they found that in this area, only one out of the 5 studies that they found was ineffective. So, and then they had another category for other intervention areas that was looking at postural hypotension, behavioral interventions, fear of falling, and in all of these areas, all the studies they found had to be excluded because they did not meet the criteria. So the limitations. They were very specific on the criteria that they searched for. And because of this, they may have missed articles that were outside these parameters that they set up. They also excluded articles that didn't include falls or fall risk outcomes. So they really, at the end of the day, might have excluded articles that might have been appropriate just because they had different search criteria in their abstracts, or they misread maybe what the study was really about and didn't get in depth enough. So that really limited the scope. This whole study did not pull from a lot of research. In conclusion, the authors determined that there really is more research that's needed to support kind of OT's role in fall prevention, particularly research in the United States. They found that there was a lot of research internationally, but not as much here. And they really wanted this research to include interventions that reduce risky fall behaviors, managing those postural hypotension, medications, things like footwear recommendations. And then, of course, the things that we more commonly associate, like the environmental adaptations or exercise. The implications for OT research, they basically determine that more research is needed, particularly across all of these areas, and the role of OT in providing appropriate interventions that are really supported by evidence. They also wanted to increase research on maybe some of the things that they're finding internationally that are working, to make sure that those same interventions would work in the United States, that they're cross-cultural, that the same rules would apply here. And then they also wanted more research on whether or not doing therapy in a group or individual basis would be more effective. My impressions of this article, overall, I just felt that the main theme is that there's just not a lot of research regarding OT interventions and their effectiveness with reducing falls in this population. And so more research is needed. And I agree with the authors. More research should be conducted to determine if the things that work internationally are also working here. I felt that this study had a pretty small base of research. There was very limited details. And so it might not be representative of what's really out there. I felt that perhaps their search criteria really did limit the effectiveness of this article and this research on what's really out there. So overall, I think that it's important that we increase our research looking at OT and its role, and particularly if what we're doing is effective at reducing falls for this population. It's really important to build up this evidence-based practice for insurance purposes, as well as to support what we're doing with the evidence. And this is such a large impact area, with the impact of falls on our elders and their impact to their daily life. So overall, I think it's an area that we definitely need to improve our research on, and I agree with the authors. So there's the reference for this article, and if we were in person, I'd ask if anyone had questions, but we're not, so that is the end of this. And I'll show you the important thing that everyone wants to see. Can I have the camera, babe? There is my little chunky-cheeked monkey. Yeah. She's snoozing away. All right.
How many corners this movie?